Folks, we've asked, Shannon's been kind enough to speak. She's gone through a terrible trauma here. She just lost her husband. Shannon is going to speak here. She's gone through a terrible situation. She just lost her husband who was on a heart transplant list, and I just want you to hear her, whatever she can say about what's happened. She's still fighting with the insurance companies. This is a real person that's struggling with this crazy situation in our country, so please give her your support.
Yes, my husband of 29 years died on Thursday of a heart condition, and I think a lot of the reason he died was due to stress, and the #1 cause of stress in our life in the last 13 months has been United Healthcare. They were our secondary carrier, and they used every trick in the book to get out of paying our medical bills. First, they tried to say we had a third carrier who was responsible for paying stuff. No third carrier exists. Then they said we had a gap in coverage. No gap in coverage exists. Then their cards that they send out, they do not indicate if it's a small group plan or if you're on COBRA. My husband has Medicare as his primary, and so if I'm on COBRA or if I'm with an employer with 50 or fewer employees, then Medicare is primary and United Healthcare is secondary. Well, my employer said they had over 2,000 employees, so I assumed United Healthcare was primary. So all the doctors sent all their bills to United Healthcare first, and it wasn't until the end of July that we found out that actually Medicare was primary. And so everybody had to rebill everything. And then, again, like I said on the card, it doesn't say that Medicare is primary because you're on COBRA or that you have a small group and therefore it would also be primary. They just leave you totally in the dark as to who's primary and secondary, and it's intentional to get out of paying. Then when everyone resubmitted their claims, and they said that they were beyond the 90-day time frame for submitting claims. And then they let it slip when I called them on the phone that the 90-day time frame does not apply if you're the secondary carrier, because they know they'll take 90 days to 6 months for Medicare to pay, and then you can only bill United Healthcare after Medicare pays. Okay, so they played this game with one of his doctors. The day after he died, last Friday, I get a call from one of his doctors who's been getting hit with this phony time frame thing, and she said she has resubmitted the claim 4 times, and finally on the 4th time she got paid half, but she's never gotten paid the whole amount. And to make matters worse, even more incredible in terms of non-payment, we received 4 membership cards this year from United Healthcare, and each one had the wrong RX BIN number on it for Medco, which is the pharmacy company they use. So when we went in, you know, somehow they just changed it without telling us. We went in to pay for drugs in August, and the BIN number, pharmacy said the BIN number didn't exist. And I finally kind of went up the chain of command and found out what happened. But United Healthcare, after 4 tries, still could not, you know, fix that problem. And then one of the final bowls, there's so many weird things they've done, I could go on all day, but one of the final bowls was one after that RX BIN number thing didn't get straightened out. I called them on a Saturday. They're open on Saturdays. And I keyed in my Social Security number, and it said, "I'd never heard of you," the system. I keyed in my member ID number, and it said, "I never heard of you." So both my husband and I were very upset that maybe we were forcing them to pay the bills, that that they just taken it off the system. And both of us were extremely upset. We've been fighting insurance companies for 21 years now, and we were just really at the point of cracking. And then 48 hours later, we found out all it was a major system crash, but they didn't say it was a system crash. They just told everybody, we don't recognize you. But in the meantime, my husband got so upset. I said, is this stress making your heart condition a lot worse? I hope it isn't. He said, it definitely has. So that's my story. And my proposal is we just need single payer. All the health insurance carrier are is parasites, and the only reason they exist is to try to get out of paying your claims and to pay their CEOs. United Healthcare's CEO got a $1 billion stock option package when he retired. So that's my input. That's my story.